Hi everybody, I am that nursing prof and welcome to my channel. In today's video, we're going to be talking all about nursing fundamentals. So what is it, why is it hard, and what can I do to help myself pass this class? So the first thing is, what is it? It is your first nursing class, your first official NUR class. And at a lot of schools, it's in fact NUR 101, right? It's that first class. You've taken your prereqs, right? You've done your micro and your pharm and all of those sorts of classes. But I think when most people apply to nursing school, this is the class that they have in their head. This is what you're picturing. Getting your stethoscope, listening to somebody's lungs, putting in a catheter, giving an injection. These are the things we do in this class. And I think that's like the exciting part, right? A lot of students are like, I can't wait to get to FUNS. And then when they get here, they realize, hey, this is a little challenging. So let's talk about that. So FUNS is your lecture, of course, right? It's going to be a lecture. You're also going to have a lab where you learn skills, like giving injections, like doing a head-to-toe assessment. And you're going to have clinical, and in clinical is where you can practice those skills on real people, on actual patients. This will be your first exposure to actual patients. So it's all very exciting and fun. One question I did want to answer, because I have gotten this before, is this a weed out class? Now let me tell you why I don't love that terminology, weed out class, because it kind of implies that your teacher is purposely trying to, get people out of there that they don't think belong. And I don't think that's true. I don't do that. I want all of my students to succeed and pass. It's literally the reason I started this YouTube channel in the first place, is because I want you all to succeed. I would never fail somebody just because, right? Do people drop from this class? Yes. And does that worry other students? Yes. And I think a big part of that is people have this idea of what nursing is, and then they get into this class and they realize, oh, this is different than what I had in my head. I don't know that I actually want to be a nurse. I think I want to do something else. And so a lot of times they will withdraw because of that. And that tends to scare the other students when they see like, oh God, 3 people dropped out on the 3rd week of class. Oh my God, and it freaks them out. But you shouldn't let that freak you out, okay? If this is what you want to do, if being a nurse is really what you want to do, then you will enjoy this class. It shouldn't be scary for you. Now I wanted to talk a little bit about why this class can be so challenging. The first is it's a lot of information. This book is 50 chapters and 1,400 pages long. And yeah, that's a lot, right? That's a lot for you to read and comprehend in, 12 to 14 weeks, depending on how your school is. So it's a lot of information to take in a short amount of time. Also, this is your first exposure to NCLEX style questioning. So in all of your previous classes, it's been pretty traditional, right? So you memorize the facts, you take your test, here's the question, 4 choices, 3 of them are wrong, 1 of them is right. That's how you're used to taking tests. That's not how the NCLEX is. This is less about like memorizing facts and more about how you would apply information into the real world. So, an NCLEX style question, you'll have your question, you'll have your 4 choices, and they could all technically be correct. You have to choose which one is the most correct. So which one is the best option for this particular situation? And that's where it's challenging for a lot of students. But you will get used to it. It's new and scary at first, but you will get used to it. We have a wide variety of topics in this class. We cover everything from like colostomies and IVs to Florence Nightingale and modern nursing and telehealth and informatics and all of these sorts of things. They kind of seem like they don't go together, but they do. They do go together, and it is a lot of different topics. And I understand that can be very challenging for students as well. The grading scale. So depending on where you went to school, this might be your first time with the new grading scale. Some schools start you off, if they know you're going to be a nursing major, they start you off with the nursing grading scale on day 1 in your prereqs, but a lot of them don't, okay? A lot of them have the traditional grading scale, 90 to 100 is an A, 80 to 90 is a B, that kind of thing. In nursing school, it's not like that, okay? In nursing school, most classes, you need to get an 80%, which is a C, to pass the class. So that can be a little bit scary as well. And then finally, it's because you're not used to it. Everything new is scary, right? If you've never done something before, it can be scary and challenging and hard. But you're not used to it yet. You will become used to it. It will be better. You will get more confident and more comfortable with yourself in nursing school. So now what I wanted to do is talk about some ways that you can do that. Now I wanted to talk about the best ways to study for this class. So the first thing you want to do is utilize your book and the resources that come with your book. So your book will have a study guide and will also have online resources. So on these online resources, you'll see key points, which kind of tell you like the most important information for each chapter. You'll have practice questions, and then you'll also have case studies. I really recommend doing the practice questions because NCLEX style questions, the only way to get better at them is to do a lot of them. So doing lots of practice questions is going to help you. You want to do your reading, and you want to do your reading before class. So if you know you're going to be talking about chapters 15 through 20 in class today, you're going to want to read those chapters before class so you'll have a better understanding of what you're learning. And then to do that, I know that's really challenging, you want to make yourself a reading schedule. And I do have a whole video on how to do all that reading in nursing school because it is a lot of reading. Very important that you're not absent. So this is not the kind of major where you can show up whenever you want, be late, skip a couple classes, only take the test, fall asleep in class. We don't do that in nursing school. So you want to go to lecture, you want to go to every lab, and you don't want to miss clinical either. So very important that you're not absent. And most schools have an absence policy where you can miss like one clinical or you can miss one lab, but then you have to make it up. Things like that. So do not be absent, because if you miss a day, you miss a lot. Use open lab time to practice those skills. So most schools will have certain times where the lab will be open for students to come in and practice their skills. If that's not the case, you can practice at home. You can make your own makeshift patients using like a soda bottle or a shoebox. Or you can even, practice listening to your dog's heartbeat or, doing head-to-toe assessment on a teddy bear or something like that. So practice at home, and if you can go to open lab, go to open lab. You want to study a little bit every single day. Nursing is not the kind of thing you can cram for. It's not like, okay, this is what we learned in class today. I'm not going to look at this for a week, and now I'm going to look at it the night before the test. You can't do that in nursing school. You're not going to be very successful. So you do want to make time to study a little bit every day. And to do that, to make that easier on you, you want to make a study schedule. So literally write it down in your planner. From 2 to 3 every single day, I'm going to study for fundamentals. You can join a study group, so it's a little bit more formal and you have your classmates to bounce ideas off of. And you want to review your PowerPoints after class. So when we learn something new, if we review it that same day, right away, we're more likely to remember it. So if you go to class, you get your information, and then you put it away and you don't look at it for a couple of days, you're less likely to remember it. So review your information right after you've learned it. And then you want to figure out the best way for you to learn. And I don't necessarily love the, I'm a kinesthetic learner, I'm an auditory learner, because most people aren't just one thing. Most people are a mix. So what I would recommend is find out what works best for you. So if you can record your lectures, ask your teacher first, and if they say yes, go ahead and record your lectures. Try that one. Try flashcards, maybe making concept maps. That's how you like to learn. So use a variety of ways to learn and see what works best for you. And then also I do recommend, because we do talk about these things and you will be tested on these things in fundamentals, brushing up on your dimensional analysis, your math skills, and medical terminology. Your teacher may or may not teach you these things. They may expect you to already know these things. Just a few more tips about studying for fundamentals. First of all, you want to look at the big concepts. You want to look at the big picture. You have to know the why and the how of everything you're doing. They are equally as important. And then when it comes to those NCLEX style questions, airway and safety will always be number one. So when we're talking about like the patients at risk for falls, or we're talking respiration, oxygenation, and those are like options in your answer, those are probably the correct answer. Airway and safety are always number one. You want to make sure that you read the questions carefully, because sometimes the question is not looking for the correct answer, it's looking for the wrong answer, and it will say that. It will give you 4 options, and 3 of them sound reasonable, and 1 of them is like, no, that's not right. So sometimes they're asking like, which one of these is incorrect? So you want to make sure you're reading that carefully. And then finally, when you're talking about therapeutic communication, and you have a question and the options are the nurse talking and it's in quotation marks, you want to read that in your head with like a little bit of an attitude, okay? So could the nurse say this quote with an attitude? And if they can, then that's probably not therapeutic communication. So for example, a therapeutic nurse would say, "What brings you to the hospital today?" Right? That sounds nice. A non-therapeutic nurse would say, "Why are you here?" Right? So if you can read it with a little bit of attitude, then that's probably not the correct answer. So that was my video. I hope you found this helpful. Nursing fundamentals, it is an exciting class. It's your first nursing class, and I'm really excited for you to start your nursing school journey in this class. It can be challenging, but I know you can get through it. I know you can succeed, and I hope you do. Thank you for watching. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.